Yeah.
Yeah, so I think imposter syndrome really is a big topic. I have a psychiatric assistance dog as well. And when I first became an Atlas client, I remember having lots of conversations with Jen about, but I don't feel like I need a service dog. I don't deserve a service dog. I don't have anything so wrong with me that I should have a service dog. And so struggling with that piece of, how disabled do you need to be in order to feel deserving of a service dog? And Atlas's sort of, sorry, I'm struggling with my words here. Atlas's mission really is to serve anybody who could benefit from a service dog, not folks who quote need a service dog, because I think need is very subjective, right? So I certainly can benefit from a service dog, but again, to the general public, I don't look like someone who needs a dog to help me navigate everyday life and feel more comfortable in grocery stores or restaurants or social situations. And yet, having a dog with me is incredibly beneficial because they can provide that light pressure therapy, the deep pressure therapy, the interruption of repetitive behaviors that I tend to engage in when I get nervous and stressed and anxious. But it can be really challenging, especially for owner trainers that are training their own dogs with the assistance of an organization like Atlas or a private trainer. It can be really hard to wrap your head around, do I, should I really have this dog? Do I deserve it? I'm not as disabled as that other person, right? And we try not to engage in those comparisons because it's really about what can serve you, the individual, best. To what
Yeah.
extent can a dog benefit you and your specific disabilities and your specific needs as you define them, not as someone else or society at large defines them. Um,
Yeah.
And I
so
think an important aspect of that, kind of adding on to what Sasha said, is recognizing that a service dog doesn't just have to be about core functions like of day-to-day life. It doesn't just have to be so that you can walk or eat or drink or breathe. They can also be about having a full life.
Mhm.
Um, that perhaps you could walk, but you could no longer hike because of severe rheumatoid arthritis. That dog can allow you to do that. Perhaps
Yeah.
you could handle maybe running in and out of a grocery store and getting one item. But with that dog, you could now handle going in and being in that store for 10 minutes or 15
Yeah.
minutes. You could go, it allows you to have a fuller life and a more
Mhm.
meaningful life. So we really want to emphasize that a service dog isn't just a basic functional tool. They're really all about expanding and having a very full life.
Right. And on top of that, the ADA is very clear and expounds on what disability is. You're right. It's not just what we think of a very visible disability. You can't walk, blind, whatever the like a visible disabling symptom is. It expounds to quality of life, the aspects of life. There's a specific like definition that includes like functionality, social, being integrated within community, things that make us human in that way. And I do want to specify and clarify that not just because you might have a diagnosis of social anxiety, depression, OCD, like a diagnosis doesn't equal disability. And the ADA is pretty clear about that. But like there absolutely is space where if you are not able to um, interact with life in a way that somebody who does not have those struggles, that would be an indicator of what disability might look like. So, yeah, I wanted to kind of mention about that it's important to not just blanket like, oh, I am diagnosed with depression, I must be disabled. Like there's very much so like an aspect of your life that is hindered or impaired. The ADA uses words like impairment, and they list out areas of life. And it's not just walking, talking, eating, breathing, but it's also the social aspects, engaging in community, working, things like that. So while Jennifer gave a really great example, if yeah, maybe you can survive not going to the grocery store. You can just order Amazon, delivery the rest of your life. But like you also don't get out and do anything else at all. Well, that's a huge part of your life that is impaired, that a psychiatric service dog can provide um, mitigating treatment to help you engage in the rest of your life, to engage in treatment. Maybe you don't go to the doctors, you don't go to therapy because getting from A to B is so very difficult. And so when I talk about in a little bit of how to integrate into the treatment plan, that's what is the heart and soul of psychiatric or any service dog, is helping someone be able to get the services, live life, do things that they want to be able to do.